Hey guys, it's Nurse Annette from the Family Birth Center at Rancho Springs. Today, I wanted to give you the opportunity to still see what we have to offer you. During this time where we are not doing live tours, we're giving you a virtual tour. This allows you to see what we have here in our hospital from the comfort of your own home. I'm going to give you a little rundown of what we would normally talk about in our tour so that you have that information. Then we're going to go up on the floor and show you what we have to offer. In addition, we're going to give you a sneak peek into our C-section suite, an area that we don't take our live tours. So you get a benefit just for seeing this. These virtual tours will last until it's recommended that we can open up and start doing them live again. A little bit about our Family Birth Center. We have an OBED, which has a qualified obstetrician available to you 24/7 to meet those emergency needs and assist your doctor in the event that they are unable to attend to you. We have 13 labor and delivery beds. We have 25 postpartum beds. We have a level 3 Nicu with 13 beds. For now, you're going to enter in through the emergency department so that we can properly screen everybody to ensure the safety of all our patients and our staff members. Before you do that, one thing I'd recommend is that you go ahead and you register online at home. We're going to leave you a link to that to help make that process easier. After you've registered online, when you come in, as long as you bring your photo ID and your insurance card, you're good to go. You'll still have those nursing questions that we ask you, but the registration process will be easier. When you come in to visit us in labor and delivery, you'll be triaged through our labor and delivery triage, our OBED. That's where we'll determine whether or not you're staying or in labor and actually just assess what needs you have then. Things that we want you to come see us for are vaginal bleeding, like a period, a sudden gush of fluid or continuous leaking of fluid. Did your water break? Contractions. Now when I talk about contractions, these contractions should be lasting 45 seconds and going every 5 to 7 minutes. Now they also should be painful. If they're not painful, they might be pre-contractions, just preparing yourself. And when I talk about painful, think of, are you able to focus? Your pain level should keep you from normal interactions with your family, watching TV, texting, and being on Facebook. They should be regular for about an hour. Now that's a general idea. Talk to your physician to see what they recommend on that. In addition, if your baby's not moving as much or not moving at all, we want you to come see us. If you have other concerns, we are here for you. Your doctor may even send you in to see us for other specific reasons. You'll come in through our OBED and be triaged, and then once it's determined that you're in labor or you need to stay, you'll be moved to one of our regular labor and delivery rooms. In our labor and delivery rooms, we'll help you cope through labor. We'll review your birth plan and determine how to help you achieve that the best way. During labor, we can offer you various ways to control your pain. We have from the very basics, from essential oils to birth positions to counter pressure to IV narcotics as your doctor prescribes. We even have the all-good epidural to help you achieve that pain control. Once you get into labor and we progress through the labor process, it'll come time for delivery. During delivery, we allow you to still have that support person by your side. After delivery, we'll let you bring that baby up to you and put them skin to skin for that special bonding moment. We really encourage you to do that for as long as you can, but it's very important the first hour. Did you know that skin to skin can actually help decrease postpartum hemorrhage and even help a baby avoid a NICU visit? That's why we do it. We delay cord clamping, like most people want, anywhere from 1 to 3 minutes. Most of our doctors stay around that 1 minute mark. After recovery, we'll move you to postpartum, where you'll get to spend time and learn from our postpartum nurses. They are excellent to help prepare you to take this baby home with you. You'll get to visit with our lactation specialists, who will help you learn when your baby wants to breastfeed and how to do it. They've got important tips, and you know, they're award-winning too. For the most part, after you have a baby, you'll stay 1 to 2 days. Some of our patients stay a little less and some of them stay a little longer. Our average length of stay after C-section is 3 to 4 days. All of this depends on the health of you and your baby. We have specific security measures to help keep you and your baby safe. One of those measures, as nurses affectionately call baby LoJack. It's a device that we place on your baby, and it helps us know if a baby leaves the unit. We're on lockdown up there. We don't let babies off the unit without tackling somebody. Just kidding. We're not going to tackle you, but it stays on until discharge. Another thing we do is we band your baby. Each baby's assigned 4 bands. The numbers on those bands match. One goes on the baby's wrist and one goes on the baby's ankle, because those babies are like Houdini and they'll work their way out of it. The other 2 bands go on usually mom and the support person, and they stay on for the duration of stay. So those are a few of the things that we do to keep you safe. In addition to that, we are not allowing any visitors up on our unit while we are in this health concern that we have going on. Only that support person is allowed for the duration of the stay. That's to keep you and your baby healthy. Other questions I get are about circumcision. Some of our providers have chosen to do their circumcisions outside of the hospital, so check with your pediatrician. But we do have the availability to offer a circumcision while your baby's here. We do a variety of tests after the baby is born. Things to check for how well the baby's heart's functioning. We do blood tests to ensure that the baby's healthy. Have you heard of the PKU, the metabolic screening test? We even do a simple hearing screen. It's really cool to see those babies raise their hands. All these will be done before your baby is discharged. We do all of this to help you and your baby have the best birth experience possible under these circumstances and these times. Right now, we're gonna go up and see our family birth center. Follow me. Okay guys, follow me. We're gonna go into the hospital. So for safety and security right now, we're asking all of you to come in and out through the emergency department. That way we can check and make sure everybody's healthy that's coming in. Hi, how are you?
I'm well, thank you.
Good. Okay, so when you come into labor and delivery, you're going to start here in the emergency department, where they're going to ask you questions to make sure that you're safe enough to go up there and healthy enough. Follow me on up. Okay, so once you check in through security, we're going to go over to our elevators and go upstairs. Upstairs is specifically for women and children. That way we keep you separate from the rest of the population in the hospital. That's another way we're keeping you healthy. The only thing located upstairs is our women's services from labor, delivery, and our Nicu. Follow me up. Okay guys, we're gonna go over and check in and pick up the phone. The secretary will answer and they'll get a nurse to come and see you. Okay, we're gonna go on in and let's go see one of our rooms. Follow me. Let's go see one of our labor and delivery rooms. You'll notice when you come in, all our labor and delivery rooms are private, with private restrooms. We have all the necessary equipment that we need to care for you while you labor and when you deliver. In addition, we have the needs to take care of your baby in case of an emergency. These beds are not just your normal hospital beds. They're designed specifically for labor. And they help us as you go through the labor process to help you get more comfortable and to make it work. We can put you in several different positions just to assist. We also have central monitoring. We can watch your baby from in the room to out at the nurse's station. There's always eyes on you and your baby. We like to also point out the amazing new daddy beds, what we've kind of called them. These are pretty comfortable to sleep in and spend the night with your support person. They fold down to almost a twin size. I've even spent nights on these. They're pretty comfortable. Okay, that's pretty much it for our labor room. We're gonna let our camera take a spin for you so you get to see the whole room. Okay, this is where we're going to go behind the scenes, and I'm going to show you what our C-section suites look like. Follow me. So we have our C-section suites close enough that in the event of emergency, we can get to them fast. In all honesty, if we have an emergency going on with a baby, we can have that baby out between 7 and 10 minutes. That's pretty darn fast from the time we leave your room to the time the baby's out in the OR. Okay guys, this is a spot that people usually don't get to see. Here we go into our C-section suite. Come on in. This is the extra birthday party. This is what an operating room looks like. This is where you'll lay down and we'll care for you and care for your baby. We have the important medical equipment for both of you to meet those emergency needs. During a C-section, if it's planned, we have the opportunity to go ahead and have a clear drape. Many moms want to see the baby coming out to them. You can experience that in a planned C-section. Also, we have many moms that even breastfeed while they're being repaired after a C-section. We do skin to skin in here. We provide an additional nurse just for that support. So after your C-section, you'll have about an hour or so to recover here in our PACU. This is the time where you can bond with your baby. Your significant other or support person will be at your bedside during this time. Most of our babies are breastfeeding in here, but mostly we're doing skin to skin to help you bond. Okay, let's go finish your stay. Let's go see a postpartum room. That's where you'll recover for the majority of your time. Usually about 1 to 2 days for a vaginal delivery and 3 to 4 for a C-section. Follow me down. Okay guys, follow me. Let's see this postpartum room. Like the other rooms, all our postpartum rooms are private. Private restroom and private sleeping area. This is where you recover. The bed is slightly different than our labor room because it's made for recovery. But we still have our notorious daddy bed to help your support person recover with you and sleep. So we always have eyes on you and your baby. We have central monitoring that all our nurses are able to see. You might have a different nurse pop in and help from time to time. That's because when you're up here, you're everybody's patient, not just one nurse. We also provide a nourishment room for you and your support person while you're here. In here we have coffee, tea, and water. We even have a microwave if you need it. This is where our level 3 Nicu is. We're not going in there. We take precautions with our babies. Thank you for joining us on our virtual tour. Until next time, from Nurse Annette.